Hey guys, it's Hina Sheth here at Rebalance Physical Therapy in Philadelphia, Pennsylvania, and on the main lines in Narberth, Pennsylvania. And I am an orthopedic and pelvic floor physical therapist that treats in a holistic, integrated way. And I love talking about different diagnoses to help all of you who might be kind of going through certain pain issues or complex pain issues, and you're not quite getting either the help that you need or the understanding to find the appropriate help that you need. So today I want to talk to many of you who might be having some snapping, popping, or grinding in the shoulder blade region, which is creating pain and limiting your function in terms of when you're using your shoulder, or even having issues in and around that area. So some of you may have heard of the diagnosis of a snapping scapula, and it is exactly what it sounds like: snapping, popping, grinding underneath or around the shoulder blade. Okay, scapula basically means shoulder blade. And I want to talk to you about what that exactly is, why that can happen, who is typically more susceptible to it, but really it can happen to anyone, and what treatment options are there and what type of treatment can help this condition. So first of all, in order to understand what is going on, we have to look at the anatomy, obviously. So this picture here is, we're looking at the skeleton from the back, basically. This is the rib cage. Here is your shoulder blade, otherwise the scapula. So I'm gonna interconnectedly kind of use those together. But in a resting position, your shoulder blade actually sits on top of the rib cage. And you can see that there is kind of a connection there, but there is some space underneath that shoulder blade. And if that space becomes thinner, meaning there's not enough room for that shoulder blade to move around on that rib cage, then you can get essentially too much friction, which creates grinding, perhaps popping and snapping of that shoulder blade on top of that rib cage. Now, that shoulder blade basically moves anytime that you start moving your shoulder. And the shoulder blade really moves when you start doing overhead work, okay? So the people who are more susceptible to this typically ends up being, people who maybe do overhead sports. They're using their shoulder a lot overhead, occupations that require a lot of overhead work. You may experience it more. It doesn't mean that other people aren't susceptible, but you might experience it more. Now, this can cause pain in and around this area, can pain further down below, can cause pain down into the arm. It can also cause discomfort up into the head and neck, and I'm going to show you why. Now, sometimes there are certain people who are more susceptible to this because either anatomically they were born with certain changes in their anatomy. There's nothing you can do about that. You can't change the anatomy of what you were born with. However, because of those changes, sometimes you develop muscular imbalances and compensations in order for the body to still function. So that can change how the muscles in and around that area work and make this condition sometimes worsen over time. Now, obviously, you can also have trauma in this area. So either a bad fall, car accidents, impact in this area that changes the way that shoulder blade functions. There's also cushioning underneath that shoulder blade. So think of like a fluid-filled kind of pillow. It's called a bursa that can sit in between basically the rib cage and the shoulder blade, and that can become inflamed and cause pain. So there's a lot of initial things that sometimes can be what's called an acute pain, which means you just have a lot of pain and you got to let it calm down. So sometimes rest, ice, those things, NSAIDs can help. However, if you are continuing to have this issue and you've tried a lot of those things and you're still not getting relief, then you got to look at the musculature and why this might be happening. So the thing that I want to focus on this video now is a lot of the imbalances that can happen in and around this area and how that can contribute to shoulder blade, this snapping shoulder blade kind of syndrome. So in America, we are, sitting more and more these days. We're sitting at the computer, we're on our smartphones, we're essentially more sedentary than we used to be. As we get older, as we're younger, we're much more active, but as we get older, we're now, working, we're in occupations, we're sitting more, which is going to change the posture that you have. When you kind of develop a rounded type posture, it actually changes the way that shoulder blade sits on that rib cage, and that can create imbalances not only directly around that rib cage and shoulder blade, but it can actually change musculature that's connected in the front of the chest, but also into the head and neck, and even down further below into the pelvis. So I want to show you this picture right over here. When these muscular imbalances happen, okay, they can happen basically anywhere around this shoulder blade area. So here's the shoulder blade, here's the rib cage, and here's the shoulder joint. This is obviously the head, and then underneath all this musculature is the neck. But look how intimately a lot of this musculature is actually connected. You have musculature that attaches to the head, that attaches to the shoulder blade. And then you've got musculature that attaches to the shoulder blade down to the arm. But then some of that musculature attaches to this midline, and underneath that is your spine. So the spine is connected through musculature to the shoulder blade. And if you peel this layer off, you can see that deep underneath here, you've got another layer of musculature. And actually underneath this, which is not shown, there's another deeper layer of musculature. But you can see how some of that also attaches in and around this rib cage all the way down to the pelvis. So the body it's amazing in the sense that everything is actually interconnected to each other, and it can actually influence each other. So oftentimes, people who are coming in with issues around that shoulder blade, they're also experiencing perhaps head and neck issues, or maybe vice versa. It started out with a head and neck issue, and now it's become a shoulder blade issue. That happens all the time, and I see this happens all the time, and I see this all the time in our clinic. So oftentimes when I'm treating someone for these conditions for the shoulder, I'm also treating head and neck, and I'm also treating down in through here, and I'm also treating down into the pelvis, because you can see how this all is interconnected. And again, if you look at some of that, again, remember I said you can peel that deeper musculature off, which isn't shown. Well, I want to show you some of even the third deeper layer of musculature here that connects, again, shoulder blade, which is right here. Here's the rib cage right here. But that musculature actually goes up into the neck. But look at this. It also goes into this area, which is part of the TMJ, or your jaw. Okay, so yes, even patients that have TMJ, and for some of you, you're not going to know what I'm talking about, but those who have TMJ issues know what I'm talking about. Even people who have TMJ issues that are experiencing shoulder blade issues, this can all be interconnected together. So it has to sometimes be treated together, okay? And then not only in the head and neck and then the back, but you also got to look in the front, because the front of the chest musculature, okay, because that rib cage comes around and it actually attaches to the front of the sternum right in through here. And you can see here that this musculature, this is basically your pec or your chest muscles. And if you peel that layer off, you've got other musculature deep down inside, okay? This all is interconnected together. So you sometimes have to treat the front of the chest in order to influence that shoulder blade that sits on the back of the rib cage, okay? So this is a circular thing. So if you are experiencing a lot of these symptoms and a lot of your treatment has been in the back, perhaps the front needs to be addressed, or perhaps the head and neck needs to be addressed as well, okay? So what do we look at when we're looking at treatment? So I know at our clinic, we treat a lot of different things. Sometimes you do have to treat all of the musculature in the front, in the back, in the head and neck, TMJ, even down sometimes all the way into the pelvis. You have to treat all of this together. And sometimes you even have to, we're gonna go back to my first picture, sometimes you do even have to treat the joints. Now this is the spine right over here, but sometimes you have to treat the spine to influence what's going on in that musculature that attaches to the shoulder blade, and even higher up into the joints of perhaps the head and neck, or even down into this picture that I showed you, which is potentially part of the pelvis, okay? So if you are looking into treatment, or you've perhaps had treatment and something's not helping symptoms in this area, perhaps you do need to find a therapist that can kind of treat you in this holistic manner, okay? And not only treating this musculature that's creating this imbalance, But then you got to layer on something else into it, which is, okay, fine. Maybe if you've created some balance in this musculature, okay, then now you've got the flexibility, the posture is starting to look good, but now what's going to hold you there? These muscles that have been tight, perhaps for some time, they don't automatically become stronger. Sometimes certain muscles do, but sometimes that muscle has to be retrained. So then you might have to do what's called stability exercises around the shoulder and the shoulder blade and even into the head and neck to then keep everything, all the muscles working better and functioning better. And then also being coached on posture, because now if you have good length of the tight muscles, now you can assume better posture, but you need to be coached in it. And then you got to keep your body stronger in order to keep it there. So treatment sometimes can be a finesse and different combinations of things that you might need in order for your body to work as a nice, work synchronistically with each other, kind of like an orchestra, right? You have all these different moving pieces and different musicians, but in order for a musical piece to sound beautiful, essentially, and the same thing for your body to move well, everything has to be working in certain sequences together. And sometimes you have to retrain those muscles to now what's called fire in the appropriate manner. So if you live in and around the Philadelphia and the mainline area around us, no brainer, come see us. These are the things that we treat every day in this way. You can come onto our website. It's rebalancept.com. That's REBALANCEP as in Peter, T as in Tom, pt.com. We have lots of other videos as well, so come check out our other YouTube videos, because a lot of these things that I'm talking about, there's a lot of overlap on some of my other videos. So perhaps if you're dealing with pelvic issues and shoulder blade issues, that might help you kind of make that connection of what might be going on there. But if you don't live in and around this area, then feel free to shoot us a contact on our contact form on our website. We can perhaps point you in the right direction sometimes if we definitely know certain physical therapists, especially in the bigger metropolitan areas. And if not, we can perhaps help you find somebody closer to you. So I hope you found this video helpful. I'm sure some of you are gonna, and I get this all the time, write me back and say, hey, but I wanna know about treatment and how can I help myself? And for those of you guys, videos are coming. There's only so many things that we can do as a company, but there are certain self-help videos that are coming, but realize that some of these things actually need to be treated by a professional. There's certain things that you can help yourself, but this is the whole point of some of these videos, is to help you understand what you might need. Not all of it is going to be able to be completely solved on your own, but if you have a good understanding, you might be able to at least be able to find a practitioner in your area, or even if you go in and you talk to your physician, it might just help you understand what they're trying to tell you as well. So again, I hope you found this video helpful for many of you. Again, come check out our website, subscribe to our videos, and I will talk to you soon. Thanks. Have a great day.